Hi, I'm Andy Loynd. Thanks for joining us. Today on the show, I'm going to be talking to a DPC doc from my home state of Massachusetts. He actually happens to be my doc, so it's going to be a fun conversation. He's a great guy, and I'm looking forward to speaking with him. Dr. Jeff Gold. We share a lot in common, I think. You know, we're both sort of Boston area natives. We both have pleasing dispositions and personalities.
Not bitter, not bitter at all.
No, not dry or cynical or anything like that.
Nope.
But take us back a little bit to, you grew up in, is it Swampscott?
Yeah, I grew up in Swampscott.
Okay.
Yep. Went to high school here and then went to college in Philly, came back to UMass Med School in Worcester. And then I went out and did my family medicine residency out in Scottsdale, Arizona.
Okay, well, let's get into that in a moment. What I'm curious about is, can you tell us sort of when you were, at what point in your life you decided, hey, I really would like to become a physician? How did you get off track and sort of decide on that?
I think, when I realized I wasn't as good at hockey as I thought I was, luckily I had always done pretty well in school and, kind of like science and the human body and not in a weird way, just, in a medical, scientific way. And, my mom's parents I was super close with growing up, and I used to stay, they lived about 3 minutes away. So I used to stay over their place every Saturday night when I was a kid growing up. And my grandmother was, very active, vivacious lady. And unfortunately at 62, right after my freshman year of high school, started showing signs of, cognitive decline and dementia. And it was kind of my first exposure to how really whacked this system is. She worked her whole life, ran a small business, paid taxes, and when it was her turn to get help, from Medicaid, we couldn't get her approved because my parents had taken over the business, and the state felt that she was still getting an income. So we tried to take care of her at home. My mom's an only child, I'm an only child, so it was pretty much my mom, my dad, my grandmother's best friend, who was like a second grandmother to me, and me, and, taking care of her. And we got her finally, got her in a nursing home because it was just unmanageable. And when the money ran out, because it was cash pay, we had to bring her back home. And like 2 weeks later, she passed away about a couple weeks after I graduated high school. And, it was a blessing. And I think that from that point on in my medical education, I've always felt that not only do we do a crappy job taking care of people regarding life and living, we also do a really crappy job when it comes to death. And the fact of the matter is, it's a fact of life. It happens. It's going to happen to all of us. It's the end game. And, you try to make the best of the time you have here, and the quality and of life is a big deal to me. And I think there's so much, I felt that there was so much from a primary care aspect that I saw change from the time that I was a kid, being brought to the pediatrician, on a Saturday night at his little office on the side of the house, and, for something, versus the, cattle call, assembly line, bureaucratic bullshit that it's turned into.
Yeah, I can so relate. Fond memories actually of being a kid and my mother driving me, whatever it was, once a year or a couple times a year, to Dr. Taub's office at off Route 9 in Wellesley. I think it was Harvard Pilgrim House, and I have these memories of even what the office, the building looked like, and going in, and he'd come in his white coat and just, being a kid and really growing up in the 80s, and physicians and doctors just were, sort of these highly esteemed and respected and regarded figures, right? And, guys wanted to be doctors, women wanted to marry find yourself a doctor, and somehow, somewhere along the line recently, I've realized through speaking with other physicians a lot, with you, but with others as well, is that's not how it really is anymore. I mean, the healthcare system is just kind of just really run them down. And can you talk a little bit, I guess, about this concept of the suffering of physicians in that system, that sort of broken system, and this word burnout? Have you experienced any of that, or did you experience any of that as you got into practice?
Yeah. And I mean, I know when you used to work for Z, the term he used was more moral injury. And I kind of, I don't like burnout and I don't like moral injury because I think we sugarcoat things too much. I mean, it's flat out abuse is really what it is. And, if I had a woman, coming into my office who was telling me that her husband or partner was treating her the way that physicians get treated by administrators and insurance companies, I would tell her to get herself out and extricate herself and get healthy. That's how really bad I feel it is. And it's not like the old days where, like, used to hear about, attending physicians in residency, grinding you down like a slave. Like, that's not the abuse that, I'm getting at. It's much more of a subtle, kind of thing where, look, you don't go through, no matter what field you go into, whether it's primary care or, specialty, you don't go through 4 years of extra school and a minimum of 3 years of very intense training if you don't mind working hard. But when you're working hard at doing crap that has nothing to do with what you signed up for, and that power is taken away from you, and look, I'm not going to say, that we're not responsible either to some degree for, the generations or two of the last two generations allowing it to happen. Doctors are like, oh, I don't want to run a business. These guys can come in and do it, and I can just practice medicine, right, until you're seeing 30 people a day, to pad their wallets. And I think it's, it's very subtle, and it really is, it's not a job, it's really a career. And I think it's something that I think when you really are doing the work that you train to do, and I think people in any career would feel that way. It's very enjoyable, but you're trying to fix a system now that is so broken, that it just needs to be completely disassembled and reassembled. And I think that it's, you feel like the Greyhound. If you've ever been to a dog track, which obviously I'm sure you frequented one, you feel like the Greyhound chasing the rabbit. It's, they wave it in front of you. Oh, you work 4 days a week, then it's 4.5, and then it's 5, and you're just never making enough, and it's never enough. And it just got to the point where I started asking myself, would I want care for me like this, or anyone in my family, or anyone that I cared about? And no, I mean, my dog gets better care at the veterinarian.
Right. It's like somewhere along the line when healthcare became a business and hospitals became, businesses run by suits, profit centers, which, speaking of Z, one of the things he said to me once that just stuck was, and Z Dog MD, in case anyone was wondering who Z is, but he said to me the concept of hospitals as profit centers is absolutely absurd because they represent failures in healthcare. Meaning, if you had basic primary preventative care through a relationship with a doc, then you don't want to end up in the hospital, right? But this idea that, hospitals are these profit centers, and then the suits are bringing doctors into their offices and telling them you need to get, RVUs, and you need to do more of this, and our patient experience scores are down. So you need to make sure you're making the patients happy because they'll, give you a bad rating on Yelp. Like, just what? These are just like insane concepts that don't seem to line up at all with actual health care.
Yeah, but I'm gonna push back on you a little bit for a second, because I don't think it is a business. I mean, there's no way around that. It's just a really poorly run business that's making. It's one thing if the profit. What we have in health, when people say we've never tried, a free market's been tried, blah blah blah. We've never tried a free market in healthcare. And again, I'm not talking about when you're having a stroke or you're having a cancer. I'm talking about everything that happens before you step foot, in the hospital. We've never had a free market, and we don't have capitalism in healthcare. We have crony capitalism. So a business, it is a business. People have to make money. They should earn what they're worth, but it comes down to what you value and what you're doing with the profit. And when you're building these state-of-the-art centers and you're actually calling yourself a nonprofit in getting the tax benefits of being a nonprofit when you're a multi-billion-dollar institution, but yet you can't give your nurses and your doctors and your staff raises, that's a problem. So, I don't think being a business is a bad thing. And this is on recording. So, I mean, I'll say it, if I am able to grow the way I want to grow, with the DPC model and, make millions of dollars or whatever, I'd be more than happy to build, use that money to do something good with it. And whether it's a free volunteer clinic, in an inner city to help people that, truly can't afford $75 a month. Profit's not a bad thing. It's what you do with it. And, it's just, there's gluttony, and there's cultural issues in this country that, you were saying, when you're growing up, you're taught, either be a professional, a doctor, or a lawyer. I should have stuck more with being a first baseman. I mean, the reality is we are paying athletes, and I'm a sports guy. I love sports. I'm not going to sit there and say I don't, but we have priorities where those people are valued at $15 million a year, but a cardiac surgeon, operating in someone's open chest and spent, 8 years extra of training is making a decent salary, but really compared to that. So, I think it's really a shift in terms of what we value. And the reality is, when you don't think you're paying for something, do you really value it?
Yeah. Now, what is direct primary care, and how did you find out about it, and how did you get into it?
It's, if I could have like a slogan, I'd probably say, something like primary care without the BS. But, we have to be very careful with how we speak today. But, the reality is that for years and years and years, I knew the system wasn't right. I couldn't formulate in my head really what the best way to fix it was. And then I started realizing that, car insurance is basically real insurance. You pay a reasonable monthly fee and you have coverage that, God forbid, you're in an accident or a tree falls through your car, you're protected. But you also have incentive to drive smart, because if you don't, then your costs go up. But you ask people what good health insurance is, and they say it pays for everything. So if you want to talk about a good example of cognitive dissonance, that you can start with how we pay for healthcare, particularly, primary care, because what we've done is we've shrouded everything behind about 3 layers where the consumer, the patient, And the provider, I mean, it's the only industry, the business that I would, maybe in the world, where the provider and consumer of the service at the time of service have no clue what anything costs. So what incentive, I mean, you would hope that personal pride, feeling good would be motivators, but what incentive does anyone in the US have to take care of themselves? Zero. It's covered. Oh, I need more medication. It's just another $10 copay, even though the drug costs $3. So I always say it's kind of like, you read, I forget the guy's name, but he's a big healthcare economist out of Princeton. And, you always hear them say that, Econ 101, the same rules don't apply to healthcare as other industries. Really? Like, how? Explain that to me. Like, again, yeah, you're having a stroke, you're having a heart attack, different story. But if I need an MRI of my shoulder, shouldn't I know what the quality is and what the cost is and be able to shop and compare? And, it's hard to blame people, for using insurance as a form of payment all the time, because they've been made to believe that everything in healthcare is so expensive that if you don't use insurance, you'll go broke. But the irony is, what's making people go broke? The insurance and the cost with it. So for me, I started feeling like not only could I not take good care of people, but I also couldn't take good financial care of people. And that really bothered me. It never sat well with me. And I had come across, I'd heard about concierge medicine, which again, I don't begrudge anybody doing it, but it doesn't get to the root of what the problem is with our system, or one of the main problems is with our system. They still bill insurance for $5 lab tests, EKGs that cost $2.25. And what I loved about DPC, what I heard about it, and the good thing about this generation, just in going aside here, is the awareness that they have of,
Right.
You're just on a call and it's like, let's just make as much noise as possible in the background. Just total lack of awareness.
Oh my God.
Zero given.
Yep.
So
it's okay.
Just wanted to go on that aside there. I'm sure we've all experienced this.
Yeah. But if we were at my house, if we were doing this at my house, my father, who are you talking to, Andrew?
Yeah.
Who are you?
Yeah. So I think when I learned about the direct primary care model and was like, we can take care of people from all different walks of life, all different complexities, for literally about a cell phone bill a month, and actually bring market forces to help hopefully drive the cost of health care down, but also more importantly, bring the cost of health insurance down. And that's what people don't understand, is only industry that when you say that you take cash, people's heads spin like The Exorcist.
It's so true. Yeah.
It's like, what? You're not going to use insurance?
Yeah.
It's $50.
Yeah.
I just spent that at Starbucks like 2 days straight. Like,
right.
So I think that that's what really drew me to the model, and the passion, and the fact that there were people across the country that were giving up jobs. Look, dude, I was paid well. I mean, I made really good money for a primary care doc. I had great benefits. But it's like one night stands versus being in, a solid relationship with somebody, like, it's great. But then like the next day you wake up and you're like, I got to do this again, So and that's really, all joking aside, I mean, that's what medicine really is about, is a relationship. And it's about, trust, and it's about mutual respect and discussion and conversation. And again, I think this is a parasite like through all of our society, but people don't talk to each other anymore, and it's sad,
Not
it's
even in
really
the
sad.
doctor's office. You
Yeah,
go
you
in
stare
and
at
he's looking at it. They'll glance over the laptop at you a few times, and then within you want to tell your story, and you can tell, you could get that body language, that sixth sense that they're trying to wrap things up. And your average patient. I mean, I'm relatively sort of informed about healthcare now, just because I've worked amongst it. But your average person doesn't know. They just think that the doctor doesn't care about them, or they have time for them. And that's not the case. It's because they're working for this organization that they have to see 30 more patients in that day.
Remember the scene in the tavern scene in Star Wars where they're playing like chess with like the little guys on the board?
Yes.
Like,
yeah.
It's really a good example of what has happened to patients and doctors like in this system, is that the irony is, without the two of us, there is no system. Right. But we're the pawns. We're the little chess pieces being moved around. And so what ends up happening is, you put in these third parties in the middle of the chessboard. How are you ever going to have an effective chess game? Like, you can't. Right. We have the rule makers or the people playing the game, and it doesn't work. And the sad thing is, I think the lay public, including employers, are so shrouded from it because it's so purposely. I always say, people say the healthcare system's broken. I'm like, it's not broken. It's working exactly the way they want it to.
Yeah.
Right.
That's it. In terms of if you actually wanted it to be about health, it's broken, right? The whole thing is upside down. But for the people who are making out like bandits from it, it's working perfect. It's working beautifully.
My favorite meme ever is, have you seen the prior authorization meme?
I may have, but refresh my memory.
So it says doctor, semicolon, semicolon. Patient needs to the pharmacist. Patient needs this prescription. Patient goes to the pharmacist. The doctor said, I need this prescription. Pharmacy says to the insurance, patient needs this prescription. Insurance company, why don't we ask the doctor if the patient needs the prescription? Really?
Yep. All right. That's all great. But let's talk about me for a minute. I don't think that we established, I'm actually your patient. Right?
Oh, you are?
Now, so I had come to your practice because I had learned about DPC and it had some pretty bad experiences trying to find a primary care doc. Everybody's like, you got to go see this guy, Jeff Gold. He's off in a peninsula called Marblehead. It's, like an hour and a half away from you. But I drove up there, I made the appointment, and I walked in. And in all seriousness, though, just the whole setup from the patient perspective, night and day. I mean, you didn't even have a computer in the room, and you sat there and you talked. We got to know each other for about 45 minutes before we even really dove into medical stuff. You asked if I wanted a prostate exam, and I was like, yes, but then you said, I'm just kidding. You don't need one until you're 50. So, but
I was taken a little back by your enthusiasm for that, but I get it.
Tell me something. Let's get crazy here. Tell me a funny occurrence in the exam room.
I mean, I actually have like a mental notebook that I'm going to do like a memoir someday, where each page is just going to be like one little funny story or good story. But
I'm sure that they'll sell like hotcakes.
Yeah. Well, speaking of hotcakes, I mean, I've had a lot of foreign, good foreign body stories that are located in all the wrong places. And they've been in those places for a number of days, festering. Those are always good.
Dr. Jeffrey Gold of Gold Direct Care in Marblehead, Massachusetts. He's a handsome, jovial community, beloved by his community, and we really thank you for checking in. We'll dive into some more stuff and kick things up a notch, maybe in another session. But you got a lot to get to, so we'll let you get to it.
Well, tell me something about my question that I'd like to know, how to really have you answer.
You want to know something about me? Sure. Okay.
Yeah. What kind of product do you use?
Oh, this is what do I use? I have a variety of sort of, I could never quite find the right one, but this is
No,
like,
I think you found the right one, dude. I mean,
okay.
I
This
know
is
you, and this may be the best I've ever seen you look.
is I mean, I'm looking at myself now in the camera and I'm like, wow, it's a little lighter than I'd like to see. And I don't know if it's the lighting specific, but just the sort of natural flow. It doesn't look like I tried too hard. And I wore this shirt for you too, because I also, I've been wearing basically just hoodies and t-shirts for the past year. And I said, you know what, for Dr. Gold, I'm going to put on a shirt tonight.
Did you put on pants?
I'm just wearing, your standard dungaree pant.
Wow, I have not heard the word dungaree in age. Are they Lee's or Wrangler?
These are I believe they're a Levi dungaree, and my Boondockers. If you're from Massachusetts, then this stuff should be making you folks. Even though we're not live, but
yeah, but I mean, I think the other thing, we should, maybe talk about the next time, because I think I should be your co-host is what I think.
Well, we're getting our sea legs here. I'd like to lighten things up a little bit. I mean, you took us through, a real roller coaster of emotions in this session, but I think
did you feel it? Because I
did. I felt it. I felt it. I felt it right here, just kind of a weight.
Ebbs and waves.
Well, this has been a really fun conversation. I think we learned a lot, and I really want to thank my guest, Dr. Jeff Gold. Jeff, thanks so much for coming on. And I also want to thank all of the viewers. If you found this conversation enjoyable or informative, maybe you give us a like. We'd appreciate it. Until next time, I'm Andy Loynd with Winning Healthcare Food Fights Without the Mess. Thank you.